Hi, everyone. Bring up my slides here. Okay. What would life be without a PowerPoint presentation? So I'm going to be talking to you a little bit about the Honors Practicum. This is the class, not of this year, but of last year. We've got to get a picture of this year's class. So just in terms of big picture, this is a two-quarter practicum. It goes over winter and spring quarters, and there's two classes a week. Usually it's on Tuesday and Thursday. And unlike the capstones, we accept only 20 students. Their enrollment is usually a little bit around 30 or over. It's an intense course. It gives 6 credit hours per quarter. So what it means is there's several hours outside of class where you will be expected to be meeting with your team and working. The honors practicum is kind of minimum didactics. I do very little lecturing, and it's maximum kind of learned by doing. There's a few overall group sessions and lectures, but otherwise we use the class time for group or team activities. The course is usually built around a survey of interest to the campus stakeholders, and then in the later spring, a smaller qualitative in-depth study. In 2024, we looked at food insecurity and use of the campus safety net, and this year has been oriented around financial insecurity among undergraduates here at UCSD. The topic for next year has not been decided. It will probably get decided over the course of the summer and early fall. So, who I am, just to give you a little bit of background, I did an honors program in college back in the dark ages, probably before most of your parents were born. And I was actually in the fourth graduating class from the UCSD Medical School when it consisted of a single building surrounded by empty fields. I trained in pediatrics at Los Angeles Children's Hospital and worked as a pediatrician for a couple of years, and then did my MPH up at Berkeley. And then I was at the Centers for Disease Control and Prevention for 20 years. After that, I ran a field epidemiology training program in Italy for another 8, and then worked for UNICEF, the United Nations Children's Fund, as Chief of Policy and Evidence for Health. And then I retired yet again and began to work for USAID, which, as you know, no longer exists, and also do domestic consulting. I started around 2011 teaching at UCSD and SDSU in the joint doctoral program, and was involved actually in setting up the Bachelor's of Science in Public Health program. I've been running the honors program now for 8 years, and in the past I've also taught an outbreak investigation course, which I hope to do someday again. In my spare time, I love to cook and I volunteer at the zoo. These are just some of my friends from the zoo cameras, the orangutans and the polars. So, research experience, got lots of that. I have more than 200 publications, but I've never had, like most of the faculty, an NIH grant. That's why I'm a professor of practice instead of just a regular professor. I've done a lot, applied research and evaluation in a lot of different fields and worked in more than 20 countries. And a lot of the studies that I did throughout my career, both at CDC and UNICEF and in Italy and every place else, were based on the types of projects that you will be doing, which take lots of goodwill and energy, lots of good brains, yours, and minimal to no budgets at all. So, what you should know about me, I think there's a few things, and my students can tell you more about this. When I was in Italy, my students called me caterpillar, which is basically the Italian term for bulldozer, because basically I don't let anything stop me, and I really push forward with things. Uh, I helped set up when I was at CDC a field site in Botswana, and this was my going away gift, which shows a butterfly and a porcupine. And I think this kind of also reflects my personality. I am a little bit prickly, but at heart, I am a butterfly. Also, because I flit around a little bit. The other thing is on a perfectionist scale, I'm way out there, and what I expect of the students is a lot of perfection. And as they will probably tell you, we do and redo things until they reach that level. And there's a reason behind that because we're working with campus stakeholders. I put this on. This is I asked the students to develop a badge to reflect the course. This one did not get the final approval from the entire class, but came pretty close. But you kind of get an idea. This is not an easy experience, and if you get through it, you're great. So, course background. Basically, teams. The students are working in teams of 5 students during the first part, and then when we do our qualitative study, generally 4 students, to conduct a study relevant to UCSD that I choose. These are not driven by what the students want to work on. It's projects that I choose. These are stakeholder driven rather than investigator or student driven projects. And I'll talk to some about our stakeholders. We fortunately have the ear of a lot of very high-level people now at the university that have been using our findings to actually change some policies here at UCSD. It's a more active student role than most university experiences. You're out there in the front doing all this stuff, and it really takes it, I think, several notches above the typical 199 or internship or capstone program. What I want to do is really, capstones are meant to pull it all together and let you use everything. And what I want to really do with the practicum is kind of take you out of your comfort zone. Days of memorizing and regurgitating aren't going to be of great help in this course. Although I do some kind of tricky quizzes to test the material that we cover. And what I want you to do is apply what you know, analyze, evaluate, and create. These are all the things that will count in your success in this course. So this is kind of at the peak of Bloom's taxonomy of learning. So we're really heading for the peak. In terms of the practicum contents, each team will do one quantitative and one qualitative study from beginning to end over the course of the year, with the emphasis being on the useful and practical, and also on providing service to our university community. The students spring quarter will all be doing a career portfolio. There are online videos and readings covering necessary didactic material, but as I said, I do very little in terms of lecturing in class time. Again, I put the quizzes on campus also to maximize the class time for the teamwork. And this is really very much a self-motivated learning experience for you to go into greater depth and to learn from your peers. Something I added this year is the judicious use of AI, and I'll talk a little bit about that at the end as well. Grading, almost everybody in the class ends up with an A, but you really work to get it. About 60-70% of your grade is based on these team projects and efforts, and 30% based on the quizzes and your career portfolio. But because we're working with these high-level stakeholders at the university, we really have to do ACE quality work here. And so what I do is I make my poor students, and they can tell you all about this, resubmit until we have something that is really good quality. There are extra individual assignments available to raise grades slightly. If teams perform well on these things, they make a maximum grade of 95 unless it's truly exceptional. And so if you really want an A+, you may need to do some of the extra credit assignments. So yes, yeah, okay. I just want to, yeah, okay. One of the things I want to mention here is your success is not going to be based only on your own initiative, but your ability to work successfully as teams. As you probably have found out, public health is truly a team sport, and there's very little that we do individually. And I think learning how to work with people, and not people of your choosing necessarily. I put students in groups based on what they're interested in working on rather than who they want to work with. I also have students go through the exercise of putting together a team contract and expect teams to resolve issues. As you always know, in every group, there are people that want to get the assignment done 2 weeks early, and then there's others that say, hey, it's not due till midnight, 11:59, what's the big problem? So I think I want to have you start really thinking about how to work together as teams, and a team contract is one way that I do this. There's a lot of ambiguities and unexpected challenges that I think are also something that students wrestle with. There's not right answers and wrong answers. This is not a biostat class. And I can advise teams, but you're going to end up having to make a lot of independent decisions as a team person. So when do I stop feeding you? The second you start this class. This is a class which is going to require a lot of independent time and planning your time and working closely with your team. So just again, how I do this, identify 4 topics within a big umbrella. For example, on the food security and the safety net a couple of years ago, we looked at CalFresh, we looked at dining dollars, we looked at the food pantry, and we also looked at other programs around campus that provide food aid. And I assign those topics to students. The students can actually rank the topics, but I also take into consideration computer skills and kind of a mix of folks so that you can work together. So each team meets with key stakeholders, develops a protocol. The 4 teams ultimately develop their own questionnaire, which I merge into a single questionnaire that gets administered to selected classes. We administered it this year to selected public health classes, and also we got wonderful collaboration from the econ department and had over 500 responses from them this year. And once we get the data, each team then gets its section of the data to work on and does its own analysis and then the communication of the results on that. After we finish the quantitative work, we identify some topics for further in-depth analysis, and we constitute new teams, and then students perform some qualitative studies. One of the big things is presenting results to our key stakeholders, but not only them, but to a number of other campus and other external partners. These are the studies that we did this year for what the 4 teams worked on: student financial literacy, how students are paying for their education, how they feel about student loans and where they turn if they're having problems. We had another thing on work and work study and its impact. And then we also documented risk factors for financial insecurity and their effects on academic performance, physical and mental health, and so on. The qualitative study that we took on to go further in depth is we kind of figured, wow, we need to figure out better how to measure financial literacy. So that one was actually a mixed method study. We've got another photo voice study of how students are spending their dining dollars. Another one, it's the next 3 are basically key informant interviews of why students are running out of money and finding themselves in financial difficulty, the effects of student debt on postgraduate life, and advice seniors would give to incoming students about their staying financially afloat. And if you're interested, Dina can send you the link to that, but we're gonna have presentations on June 3rd and 5th during our class hours. You can either come in person over in the Met building, or alternatively, it's going to be Zoomed. So, what we learned to do over the course, work with stakeholders, put together a study protocol, do a logic model, develop an analysis plan, write questionnaires in Qualtrics. So you're going to learn a lot of these skills, collect and analyze qualitative data, another big skill that you're going to pick up in the process. Interpret data, make readable slides and visuals, and these are some of the slides from the 4 teams from this year. Make posters, really amazing posters that people look at. If you happen to come over to the Public Health Research Day, or if you're there at the capstone final this year, you can take a look. We do what's called billboard posters, where there's a big central message. And these are the 4 beautiful posters that we did this year. They were presented at the San Diego Epi Exchange, where we got to interact with epidemiologists from all over the county, including the Health Department, the Navy, San Diego State, and then our graduate students here, Public Health Research Day, and then at the capstone. You're going to be also doing, if you take the practicum, professional oral presentations to our stakeholders, and also giving a scientific presentation, if you so wish, on undergraduate day. And just to give you an idea of the level of the stakeholders that we're dealing with, we had Magdalena Chavez, who is a fiscal analyst who is working with us on financial literacy. We had Dr. Silvia Marquez, who is actually head of the Financial Aid and Scholarships Office. We had Todd Olivieri, who is the director of student employment and head of the work study programs. And then Alicia Magallanes, who, as you probably know, is the director of the hub. So we are getting the input into our study design and what we do, as well as feeding back these results to folks at quite a high level here at UCSD, which has been really rewarding. Something else you learn how to do is the students do social media posts and infographics. These are actually from a couple of years ago, but my students this year actually also did a superb job on this. think about your future. This is what the career portfolio is about. What I have you do is kind of put together a mind map to kind of figure out where your strengths are, where your interests are, and kind of think about that, what role your parents are playing in your career decisions. And then I have you do a really thorough look into the careers that you want to do. You know, how much money you're going to make. If you're going to grad school, how much it's going to cost, how much it costs to apply, how much it's going to cost to live, and so on and so forth. And then we also have an exercise in putting together a resume. Exploring AI, I've become increasingly convinced that AI is going to be an important part of most of your future jobs. And so you're going to need some basic knowledge and skills and to learn how to use it, but also understand what it's good for and what it is not good for. How we used it this year, for example, students at the beginning of the quantitative study put together a protocol, and I allowed the students to use it to assist in a literature review and to actually summarize the literature. You can ask to summarize papers in 100 or 200 words. And I had them, though, on this detailed document, do a detailed documentation on how they used it and whether it was useful or not. Once the students did that, though, they had to synthesize that information and write it up on their own without the assistance of AI, show it to me. And after they'd done that, if they wanted to, they were allowed to put it back into AI to have it smooth through the language and make sure it was written clearly. So it's been kind of a mixed bag. The analysis this year was done entirely by the students themselves, because AI, fortunately or unfortunately, doesn't know the statistical program I was using for the analysis. And it's had a lesser role over the course of the quarter, although it now is assisting us with some of the qualitative analyses as well. In terms of impact, this is something I feel really good about our program, is that we do have impact. Last year, we did a study that included CalFresh in there, and the students made some recommendations about what could be done to improve enrollment, because we found out a lot of eligible students, only a fraction of the eligible students were actually enrolled in CalFresh. And so we reported to this high-level collective impact working group that includes associate vice chancellors, the head of the library, the head of teaching and learning commons, the head of the hub, lots of people that have connections and power, the head of communications for UCSD. And this led to the 2024 to 25 campaign efforts to publicize and increase CalFresh enrollment. And it also spun into a grant from the UC Office of the President to develop these interventions more in depth and to evaluate the outcomes. So this is like the ultimate, what we used to talk about when I worked at the Centers for Disease Control, information for action. And I think that's the skills that I really like to build in our students, and the approach that I like to also see us build. Things to think about if you want to do the program is your time and availability. It's really a lot of time and all, and you have to make yourself available too, because a lot of the class time, or the time that students work, is after class in addition to the time they spend in class. If you want something that is, if you want to do research, this is this is research, but it's practical applications. This isn't the kind of stuff, where you grind up rats or anything like this. This is kind of the dirty real world, collect data and analyze it. The other thing is, if you have your own firm ideas of what you would like to study as part of your capstone project, you should do the other regular capstone. This is my project, and that's the downside of it. But on the other side of it, I think you can really gain a lot out of that experience. And then finally, how you feel about working in teams. If it's something you absolutely hate doing and you don't want to learn how to do it, this is not the program for you. So what am I looking for? I'm looking for commitments that you want to do something in public health in the future. And please don't apply if you want to be a dermatologist or an intensive care doc or be the next CEO biotech startup. I've got a limited number of places. And even though some of the students that do want to be dermatologists are great and wonderful students, I kind of privilege those that are more interested in public health. Obviously, you have to have the good grades, previous team experience. And these could be negative ones. I ask about this in the application process. decent writing skills, enthusiasm, the time, and I also really welcome transfer and first generation students, and of course everybody else. When you go to apply, I have a really pretty high BS meter. There's a very old expression that I didn't just fall off the turnip truck. So, if don't try to tell me that you want to be a public health educator if indeed what you want to be is an anesthesiologist or whatever. So good. Okay. So this is me. I'm older than a lot of the professors, but on the other hand, I've got a lot of wisdom, and I hope I've learned from my students so that I don't truly act my age, which is probably good. And just in final conclusions, what you'll be signing up for, an adventure that's different from anything you've had before in your academics, a long haul where you're going to ask to be used all that you've ever learned over the past 3 years and then some. The experience of working with a team that you don't get to choose, an opportunity to make a real contribution here to your university, hopefully some lifetime friendships. And my students have kept in touch with their peers after they graduate. And also, hopefully, a degree with honors, new skills, confidence, and a real sense of accomplishment. So, I'm going to open it up now for questions, and then, I'll turn it back over to Dina, and then afterwards, I am going to leave entirely, and you can ask the students anything you want, and they will be very honest with you. Okay.
Yes, so at this time, if you have any curriculum focused questions, please either raise your hand or put it in the chat. After Dr. Binkin is done answering those questions, I am going to do a 1 minute just overview of how to apply, where you can find that information, when the deadlines are, explanation that way. But we're still going to excuse Dr. Binkin because she already knows what I'm saying, and then we'll transition right into the students. So I think we already have some chats. Let's go in there. So the first question, which is definitely a question that's also going to be asked of all of our Honors Practicum students that are here today from this year's cohort, is how much more of a time commitment is the Honors Practicum versus the regular capstone? And I will say that the Honors Practicum is 6 units for 2 quarters instead of 4, but it's 6 units because the university would not approve 8 units. So it's a very rigorous class, equivalent to other 6-unit classes like biology's physiology lab, or it is a very big time commitment. And Dr. Binkin, if you want to chime in, I am going to be asking this of all of our current cohort in just a little bit.
Oh, I am going to let them chime in on this. One of the things about that too is it's variable. Some weeks there's not very much going on, and then other weeks it's like totally crazy, but my students can tell you much more about that.
Right. And then the other thing to keep in mind is the capstone is doing a portion of a project. The Honors Practicum is doing from start to finish with real stakeholders, like a real job, or being a grad student. However you want to look at it, it's kind of a combo of both, but there is much higher expectations. Now, all of the career opponents, which I know Dr. Binkin touched on with one of her slides, are in both the Honors Practicum and the capstone. So students do one or the other sequence, and so we want to make sure that that portion is the same regardless if you're doing the Honors Practicum or the capstone sequence.
Hi, Dr. Binkin. So I have 2 questions. So first one, I was just wondering, I know you talked about the qualitative research studies that you guys are going into for this quarter, and I'm currently a part of PH 155 with Dr. FM. And I was wondering, is that the qualitative research study that you guys are presenting, or that you were mentioning? No, it's separate. Okay, that's just one thing I was curious about. And then the second thing I was wondering is how are the topics of the research study chosen and decided or determined?
You know what, I will probably, okay, so in terms of your first question, I've worked very closely with Dr. Fielding Miller, and we actually use some of her materials in the course, but she teaches exactly at the same time, so I haven't been able to involve her this year in any of the teaching. But it's great when people have taken the course, because then I think they have a good background in qualitative methods. The topics are decided by, I will be, I sit on a number of high-level committees at the university, and I think we will probably try to spin something else out of what we are doing around the student survival of things. I think we're in for what's going to be a even more stressful financial year next year as some of the funding sources dry up and there's more issues with loans and everything else too. And so we may work a little bit more on that area. Usually what I do is I talk to a lot of the stakeholders that I work with on these committees. I ask them what they would like to learn, and then we build the student projects around that. So yeah.
I see. Thank you so much. That sounds wonderful.
Yeah, we're also working. I've developed a really nice working relationship with the econ department with Dr. Giacomo Rondina, and we may end up seeing if we can kind of do some joint projects there. He and I both have the Italian connection because he's obviously Italian, and I lived 12 years in Italy. But beyond that, too, we both have a really similar attitude about training and providing students with training opportunities. And I'm hoping we can kind of find something where we might work a little bit more with them this upcoming year as well.
Is it like in terms of the crossover, like intersection between public health and like business and like the commercialization of just everything, and especially with like using marketing tools?
Haven't gotten that far in the thinking, haven't
Oh, I see.
talked
Sorry.
done about that, but it's an interesting idea to think about. What I try to do is put together stuff that is kind of more immediately relevant to our reality at UCSD. For example, the group that looked at financial literacy, the head of the library found us a donor who is potentially interested in funding some financial literacy program pilots on campus. And so, this is kind of more the stuff that we're doing of stuff that can have a practical application, just like we did with really, ramping up the CalFresh activities based on our student findings. So it has to be stuff that's more actionable. So we'll be working on that.
That sounds good. Thank you.
And then there was a year, Dr. Binkin, that I remember where it was on student safety, and that was with when the e-scooters first came around the campus, and recording how many accidents, what we can do to prevent.
Exactly. Exactly. And we've done stuff on, the student access to health services and how much students know about what's actually covered by their CHIP policies, that they have a lot more coverage than they think they have. We've done stuff on some of the mental health access issues on campus and so on. So, it's like, stay tuned. It'll be interesting. Nobody's ever got totally bored by the topics we've done, and we've usually been able to have an impact.
That sounds awesome. I look forward to it.
I'm just gonna see if there's any other questions before I let Dr. Binkin go, and then we get to ask all the Honors Practicum students. All right, Dr. Binkin, you are excused.
And so if anybody has anything else, they can always email either me or Dina, and I'm sure some of the other students would be more than willing to talk to you. So great meeting all of you virtually. Don't even see any faces, but I guess I will get a chance if you apply. I interview everybody in person or over Zoom. Over Zoom these days, I think is more reasonable. And so, we'll get a chance to talk about that later. Okay, bye-bye, everyone.
Okay, so before I jump it over to our Honors Practicum cohort that we're able to attend today, I just want to put in the chat is the link to the Honors Practicum site on our website that has an overview, learning objectives, eligibility, and how graduating with public health honors looks on your diploma. The very bottom is applying. So I just want to do a quick plug. If you have any questions about applying or how this looks with your schedule, those are questions for Elisa and myself. Dr. Binkin is questions about curriculum. And then again, we're going to have our Honors Practicum, some of the Honors Practicum cohort from this year be able to answer some questions. So the way that it works with the Honors Practicum is there is a priority deadline. And so the priority deadline to apply is Monday, June 16th by 11:59 p.m. So if you apply in the early application cycle, you have the best chance of getting accepted. So Dr. Binkin selects a handful from that first group of students and gives automatic acceptances once interviews and everything have gone through and she's ranked everybody. But then the application stays open until she's picked all 20 applicants. And so there are opportunities for students after June 16th to keep applying because we have all the way through until the end of October to make final decisions. Honors Practicum course, the first quarter starts in the winter, second course is in the spring. So it's just something to plan for, but on the same timeline. So on our website, also on the application portion, it also provides all of the essay questions, which the longest essay question is a max of 300 words. The other 3 are 200 words or less. So it's not long essay questions, but I do recommend when you're applying, since it's a Google form, to first write it out on a Word document and then copy and paste it in there. The other thing that I do like to remind students is that paragraphs don't actually come through in the Google form, so you can just do it as one full paragraph to answer the question. It's not a big deal if you make it into paragraphs when you copy it and paste it in, but it doesn't format that way for us when we see it, so it's completely okay. Is there any questions about the application or deadlines that anybody wants to ask me before we jump to the Honors Practicum students, who are really the star of the show because we're going to be asking of them to be brutally honest with their experience? Oh, yes. And that was and someone had mentioned about the transportation question. So if you do not have transportation, it is not a big deal. Just indicate that you do not have transportation. In previous years, there are some opportunities that sometimes we work with the Y or off-campus opportunities, but Dr. Binkin only selects that based on student availability of transportation. It does not affect your application in any way. It's just something to be considered while Dr. Binkin is trying to look for stakeholders. Because again, the assignments that you get are real assignments that individuals and higher up areas are interested in. So this financial literacy is an easy example of what the students are working on this year. Key stakeholders on campus are very concerned about this issue of students not having financial literacy while they're in college and going into massive debt or really struggling. And of course, that affects other aspects of student health. And so that's kind of an easy example. And yes, everyone, sorry. And then if you apply and you're not picked in the early priority deadline, we still notify you if you are still being considered or if you don't meet the requirements. And one of the things that Dr. Binkin didn't mention, but there's a lot of factors that go in. It's not just grades. It's making sure that not only you're right fit, but the 20 students that she's selecting is a good cohort to work cohesively. And that's because she needs at least one person on every team to be a really strong with biostatistics. It's just an easy example, and to have that statistical analysis because you're doing a lot of that for your final report. She needs strong writers. She needs individuals that are strong presenters. And so she's trying to piece in a cohort that's going to work well together on top of making sure this is a right fit for you, because Dr. Binkin doesn't want somebody who's not the right fit, and we don't want you to be struggling if this is not the right fit. So it needs to be equally beneficial to everybody. And then this is, Honors Practicum is something that's meant to be in your senior year. We do make exceptions for students in their junior year that are very motivated and have completed a lot of the requirements, and especially for students who are trying to go study abroad in their senior year. But typically this is your culminating experience, just like the capstone. So all public health majors need to both do the capstone or the Honors Practicum as their final project, and the poster showcase that's happening next Saturday is both the capstone and the Honors Practicum students presenting. Okay, so I think that hit all the questions that was sent to me. So now I'm going to open it up. We have 1, 2, 3, 4. We have 4 of our 20 Honors Practicum students here with us today. So I'm going to be asking a couple of questions for all of them to answer one by one. So you guys can popcorn it to each other since you all know each other. and then we'll open it up for questions. We do need to end the session at 12 o'clock. So if you don't get all of your questions answered, you can send us virtual advising center messages and we will send them to the Honors Practicum students to also answer. But I'd like to start with whoever would like to start first with what motivated you to apply to the Honors Practicum this past year? And then also, do those motivations still hold true of what you were hoping to gain from the experience with the Honors Practicum?
I can go ahead and start. Hi guys, my name is Lindsay. I think what motivated me to like join the practicum was just like the topic we were doing on financial insecurity. And I think it's really nice to be able to like get involved with like the stakeholders to do like research that kind of makes like a meaningful impact on like, like our peers and stuff. And for me, it was really personal to do something with that topic. And also too, I think just like the level of research that we get to do. I feel like for me personally, like this class like really taught me how to like do public health research and it's taught me a lot of valuable skills. So I think that still holds true today. So I really recommend this class. But yeah.
I'm also happy to call on, but I feel kind of bad doing that. Does anyone want to go second? Okay.
I didn't want to interrupt anybody if they were trying to go. Um, so the reason that I applied was I was looking for like something a little bit more challenging and a way to expand my experiences. Um, so I was really excited about how Dr. Binkin mentioned she's working with shareholders that make like actual change on campus. And that's something I'm really passionate about. So I think now that I'm in the course, that does hold true. It has definitely challenged me throughout the past 6 months or so. And also we are seeing like changes and people really passionate about the work that we're doing. So it is really rewarding and challenging as well.
Thank you. Leanne?
Yeah, I can go. I can go. Hey, Melissa. So I also applied to the Honors Practicum for the same reasons as Lindsay and Melissa. I have previous experience working for some of like the collectives on campus, and we were able to do a lot of like grassroots like aid projects as part of like our communities. So I kind of wanted to find a way to understand how like to identify issues that are within like the greater system communities. And I saw that Dr. B had a lot of previous experience working with like the honors practicum to like identify issues, contact shareholders, and then like facilitate projects that will further um like I guess like disseminate like information or aid. So that was a big motivator for me.
Thank you. And we have one more. Sorry. Shiv, are you ready to go? Yeah.
Yeah, hi. My name is Shiv. I'm gonna be so honest, like I kind of just wanted to apply because I thought it would look cool on my diploma. But I think I learned a lot more and I met a lot of cool people. Kind of like what all the others were mentioning, a lot of different like research methods, whether it's quantitative or qualitative, that I wasn't really expecting. And I think it definitely like kind of blew past my expectations. I wasn't really expecting too much, but I think I learned a lot.
Thank you. And then it doesn't have to be everyone to answer, but I would like to know what a typical work week looks like for an honors practicum student, and also how many courses you were enrolled in for winter and the spring, and any other extracurriculars that you might be attempting with the schedule. If anybody feels comfortable talking about that first. And we want you to be like, it doesn't do it a good service for the incoming class if they are unaware of how the commitment is. So brutally honest is okay. Like I definitely have talked to some of the honors practicum students in certain weeks where they're like, I just got to get through this week and it'll be okay. So I'm sure the students would appreciate your honest experiences.
Oh, sorry.
No, maybe you go. It's okay.
All right, babe. Yeah. I would say it was definitely like, especially winter quarter, it was a lot. It was definitely a lot. And I remember when I went to like the info session, like when I was joining, I remember the students saying like, winter quarter is really going to be heavy. And, it's really true. You're going to be tested. It's like, I remember there were some weeks where my team, we would talk to each other and we'd be like, oh, like, we're going to be okay. We just have to make it through this week. But it's, it's definitely a challenge at some points. I think during that quarter, I was only taking, I think, two other classes. And I know a lot of my like friends too, like they were taking like multiple classes, but I would recommend, like maybe if you can, having a lighter load in the winter quarter. And then this quarter in the spring, it's not too intensive. So I would say like maybe like save the harder classes for spring quarters so you're not like, you know, not taking on too much. But yeah, I would say, it's definitely a lot of work the first quarter, but you learn a lot and it's really worth it.
Thank you. Does anyone have anything to chime in, or was that pretty much a consensus?
No, yeah, I completely agree with Lindsay. Winter quarter was really like a really big struggle for me. I was taking 19 units and then also doing some like way too much. And I think the problem is that most of the time we are going at like a steady pace, and then all of a sudden it's like I don't know, it's the deadline tomorrow, and then you're making all these crazy changes like honestly like 15 minutes before like due date or before you're about to present. So it's really like intensive in those key moments whenever something is changed on your project or something needs to be improved on significantly in on the deadline. So yeah, really make sure you plan for those deadlines because they come up quick and you never know if there'll be changes.
Thank you. So I just have one more question before I open it up, which is, does anyone have any advice for students that are thinking about applying, or anything that you wish you would have known before starting the Honors Practicum to get a better handle before you started?
I think a piece of advice I'd have would be to take advantage of the opportunities that you'll get to experience either with like presenting your research or like discussing things with stakeholders. I know this is something that like pretty much every professor will say to their student when bringing on like a guest speaker or anything, but I think I've been able to learn a lot just by talking to other people at research conferences that we've been to, or like talking to some of the stakeholders that um, Dr. B has brought on and to the classroom. Um, for instance, I wasn't really very well acquainted with the Basic Needs Center until I got into the Honors Practicum and had to do a project on the Basic Needs Center. So I think it's really useful to kind of like understand career paths in public health by like discussing what the people in these research conferences and stakeholders do on a daily basis.
Does anyone else want to chime in, or would you like to open it up for questions? Oh, Melissa?
I had a response, but can you repeat the question really quick just to make sure I was
Absolutely. What advice would you give students who are thinking about applying, or something that you wish you would have known before starting the Honors Practicum?
I think I wish, I mean, she's making it pretty, like, be brutally honest. Like, she is a perfectionist. She really will push us to do our absolute best. And I was like, yeah, okay, I always do. But no, like, it's intense. Like, she will absolutely make sure it is 100% perfect. Um, and just really take that into account. Like, you can't just do this, like, oh, I'm just gonna do the assignment. No, it's really intensive. But it's super rewarding, and she provides so many working opportunities. She's really pushing us to be our best selves, and I really appreciate that.
Thank you, Melissa. That's a really good point. Dr. Binkin tried to be pretty obvious about her personality in the session, but she is not a sensitive, coddling kind of faculty member. So she will be brutally honest, which means if she doesn't think that your work is 100%, she will continue to send it back to you, and you might go a little crazy with how many times it got sent back, because she's making sure that what's representing from this group is at the perfect level, because these stakeholders are on campus and off campus entities, and it's our reputation as well as it's publishable work and it's work that makes change. So even, in previous years when we've been off campus, the YMCA changed programs based on recommendations after surveying parents and the children in that. I know that they worked previously with the lifeguards at the beaches right after COVID, when they were having a lot of problems with um, um, keeping the beaches sanitary and clean because people were mistreating the beaches, and all of these kind of major issues where these reports and evaluations that the honors practicum students are doing are getting utilized by those organizations and by campus, and actions are being taken. So Dr. Binkin doesn't want to send something that she thinks the students could do better. So I will I do feel for the students because she sends stuff of mine back. So, it's just the experience. But it's important to note, because if you are the type of individual that does not work well with those types of instructors, she's not going to be any different than those types of instructors. So that's just something to keep in mind. And we did have a question in the chat about asking, Victor asked, we've all experienced group projects in classes, but this seems different. The groups where you're choosing to be there and want to contribute. I will say for the honors practicum, you rely on your group members, and if one person is falling behind, it negatively affects the entire group to the point of failure. So not only is everybody in this group relying on, but Dr. Binkin doesn't give you any wiggle room where one person could carry the group. So that's where it's very different than all of our other public health classes. Now, public health is our curriculum. We understand that group work is tough. That's the purpose, is you're working on your intercommunication skills and your relationships. That is actually more challenging than people realize. And so it definitely takes a toll in the honors practicum at a much more rigorous level. Does any of the honors practicum students want to talk about how your experience was in the honors practicum working in a group was different than maybe some of the group work that you've done in your previous public health classes?
I can say that if you are a student that tends to hide behind other students when working on group projects, there is nowhere for you to hide in this class, mainly because Dr. B tries to make it clear how well you are performing within your own group by having student evaluations. And at the end of the quarter, she releases the student evaluations back to the student with a list of things you did well as a project member and things you didn't do well as a project member. And that evaluation also gets counted as part of your grade for that quarter. So if you don't have experience being a solid team player, you can't really skirt by this class by not being a team player, because you will get called out and it will negatively impact your grade if you don't step up and do your part of the work.
Thank you. Yes, it's really important on that regard. And then we had a question about knowing how Dr. Binkin is a perfectionist. Can you highlight some of your interview process and something that stood out or left an impression on you? So if any of the students want to indicate that. I will say interviews are only 20 to 30 minutes. And I know Dr. Binkin said in person or Zoom, but they will absolutely be on Zoom this year because interviews are going to be during the summer, and that would be cruel to ask students to come back to campus for an interview. But I do know that they're typically scheduled in 20 to 30-minute increments. Does anyone want to talk about their interview process and what it felt like?
I would say I think one thing that stood out to me was just that Dr. B is she's a really sweet person. And I think last year I was super anxious about getting into the class because she says a lot about being a perfectionist, and she definitely is, which isn't a bad thing, but it can be a lot. But she really just wants everybody to do their best, and she's really just trying to get you guys to perform as well as possible and gain these skills that you can use later on, when doing research or whatever career you guys get into. And so I hope it doesn't shy any of you guys away from applying. At the end of the day, I really I even tell my roommates I really enjoyed this class and I'm so glad I did it. And you really do make lasting friendships, you really do learn a lot. And I know for me, sometimes I can get nervous when it comes to presentations and things like that, but I feel like this class, like, we do like the stakeholder presentations, like the poster presentations, and it just helps you get better. And, like, it's like skills, like, you could also like apply it later on, and then you can also put it on your like resumes and stuff. But yeah, overall, like, I really do recommend this class. And, she really is like such a sweet person, like, but yeah.
I just wanted to add on to that. The interview, I was really scared for just because of how she presented herself, but it was so laid back. She really just wants to get to know who you are as a person and kind of what you're interested in and why like you're pursuing the class. So just being really authentic, it really helps. The interview was great. I think I learned so much about her and she learned about me. So it was really it wasn't that bad. Like she said, like she'll be able to see through like the BS, but yeah, just be yourself and it's more of a conversation and less of like a formal interview, which I really, really appreciated. But yeah, super lucky and grateful for the class and like all the opportunities it's provided.
I will say, as just a tip, when I was interviewing with Dr. B, she was very excited about the fact that I had looked through the previous cohort's presentations and was able to kind of like talk about why I liked some of the previous presentations that the honors practicums have had. So kind of like being able to demonstrate your interest by directly referencing some of the work that has already been done in the practicum is super useful. Um, Not just because it makes you look good in the interview, but also because it kind of helps you connect better with Dr. B in terms of like why you want to do something like be part of the honors practicum.
Thank you.
Yeah, and to add on, like, I think Melissa said it best. It's more of a conversation than an interview, and I think she really values just authenticity. And so, if you're just like honest about who you are and like what you hope to gain from the honors class, I think it'll be really helpful. And I don't think you should just like, try to be someone else, try to like, boost up your accomplishments. I think it's as long as you're honest about what you hope to achieve and what you have, and like kind of walk. I think we had to submit a resume. I think like going through your work experience would also be very helpful, and just like seeing like where your interests are, and just like honestly just ask her a bunch of questions too, because she will be definitely willing to respond to them.
Yeah, I will say the interview is typically more informal for Dr. Binkin because she's really trying to get a sense of your personality. An application and a resume has nothing to do with public speaking and how effective you communicate in a verbal way. And so I think that's why she's trying to do the conversation part. Your essay questions are what should be polished, right? Like that's the what you're submitting on the application. That's where she's seeing your writing style. And so it is an opportunity to be yourself. And I know she mentioned she always picks on dermatology as a field within medicine, but make sure that if you are applying, it's because of your interest within public health. You can be on a pre-med or pre-health traditional track, but if you're not relating of how your path includes public health and how this honors practicum is going to directly affect that experience and make you a better physician or whichever health track you're on, that's not going to work for her. And like she said with the BS, you have to actually mean it. So you can't just come up with something from ChatGPT because she will call you out on it. And so just make sure that you're thinking about that before your interviews. I will say that the interviews are going to be sometime during the summer, but Dr. Binkin typically visits for several months in Italy during the summer and fall quarter kind of overlap. And so it's always kind of a wiggle room of when we're doing the interviews, but every student who applies and is eligible will get an interview. So she doesn't, every application that she's looking at, it's not like, oh, she's picking the top applicants and then just only interviewing them. It is part of the application before she makes decisions. So it's an opportunity if you're like, oh, I didn't have as much experience as I wanted. Maybe she's thinking that my resume is a little light. It's an opportunity for you to show your personality. And that I definitely think not only speaks for Dr. Binkin, but speaks for most of our faculty in public health. I did share in the chat the link to our showcase and awards. You can actually see posters from well, from last year's and before Honors Practicum students, you can compare them with the capstone posters to see the different level of and scope of work that is being done just by how much information and detail and the statistical analysis is in the Honors Practicum versus the capstone. But also this year's cohort, their winter quarter stakeholders presentation, the slides and the information are already on our website. So you can see this year's. And after next week, I will have everybody's posters, which means that this year's Honors Practicum and capstone students' posters will be on that website. So I'm just going to wait to see if we have one more question before we wrap it up. But if not, thank you everybody for coming. We really appreciate taking the time, and we will be posting this video once I splice it a little bit on the website. My goal is to get it done by Friday of next week, but hopefully earlier.
I do have a question for the cohort. So, how would you guys compare like your work dedication ethic and like discipline like towards just your workload in school before joining the honors program and like after? Were there any like changes, significant changes in how you had to manage your time?
I think really just, like having time allotted for the class, if that makes sense. Like before in like group projects, like like you take them seriously, but with this one, it's like a different level just because you have like that idea, like you have teammates that are relying on you like for a lot of the time. And so, um, I would say like like if you're already kind of like, on top of things, like especially in group work, like you kind of make sure that you contribute your part. It's pretty much the same, but it just gets amplified because again, like everyone's kind of on that similar work ethic and people are relying on you to like make sure you get your part done. So I think there's just, like having a lot of time set for that because I think Melissa mentioned it earlier, like there's going to be like days where you're submitting like resubmitting multiple times in a night or like resubmitting like 15 minutes before like a presentation or something. So, yeah, I think it just really amplifies like that like hard work ethic.
Thank you so much.
All right. Okay. And then I just had one more quick question, then I will answer. So if all the course requirements to be eligible for the Honors Practicum have to be completed by the end of fall quarter. So as long as you complete all the requirements by the end of fall, which is the exact same requirements that you would need to complete for the capstone, then you are eligible to apply. And that's all on the website that you can reference. So at this time, I'd like to thank our Honors Practicum cohort for coming and thank everybody for attending the session. And this concludes, we need to get the Honors Practicum students to be able to get ready for their class because their class starts in just a half an hour. So thank you, everyone. If you have any administrative questions, that goes to Lisa and myself in the Virtual Advising Center. You can email Dr. Binkin directly for curriculum. And then if you have questions specifically for the current Honors Practicum cohort, you can send those questions in the Virtual Advising Center and I will send them to the students to answer, but I'm not going to share their personal information. So perfect. Thank you, everyone. Have a great rest of the day.